Hello, good evening, everyone. My name is Dr. Prof.Dr.Amb.Auwalu. I'm Doctor of Internal Medicine. Let us talk about nephrotic syndrome. What can you tell me about nephrotic syndrome? Let me highlight it a little bit. Nephrotic syndrome is a glomerular disorder with a proteinuria greater than or equal to 3.5 gram per day, and it is characterized by hypoalbuminemia, hypogammaglobulinemia, hypercoagulable state, hyperlipidemia, and hypercholesterolemia. The reason why the patient with nephrotic syndrome will have hypoalbuminemia because in the process of proteinuria, the patient loses a lot amount of albumin. So the amount of albumin within the blood will be significantly decreased. That's why the patient will have hypoalbuminemia. Hypoalbuminemia means decreased amount of albumin within the blood, because hypo means decreased amount. Albuminemia means amount of albumin within the blood. So hypoalbuminemia, in a nutshell, it means decreased amount of albumin within the blood. And we know that the main function of albumin, it maintains the contact pressure within the blood. So when the amount of albumin within the blood becomes significantly decreased, so the fluid will be accumulated within the interstitial tissue. That is why the patient with nephrotic syndrome will present with what? Edema, generalized body edema, generalized body swelling, because a lot of fluid accumulated within the interstitial tissue due to what? Due to decreased amount of contact pressure, due to what? As a result of as a result of significant amount of albumin were lost within the proteinuria. Then secondly, the patient with nephrotic syndrome will have hypogammaglobulinemia. Hypogammaglobulinemia. Hypo means decreased amount. Gammaglobulinemia means decreased amount of immunoglobulin within the blood. So we know that as a result of proteinuria, a lot of immunoglobulins were lost. So the main function of immunoglobulins is what? Immunoglobulins means what? Antibody. So the main function of antibody within the blood is to fight against infection, against body infection. So that is why the patient with nephrotic syndrome will be more vulnerable to body infection. Then sadly, the patient with nephrotic syndrome will be in a hypercoagulable state, because in the process of proteinuria, thrombin 3 were lost, and the main function of thrombin 3 is to break down thrombin and destroy coagulation cascade. So that is why the patient with nephrotic syndrome will be in hypercoagulable state. The patient with nephrotic syndrome will also have hyperlipidemia and hypercholesterolemia. The reason why the patient with nephrotic syndrome will have hyperlipidemia and hypercholesterolemia is because of proteinuria, the blood loses its thickness and become very thin. So the liver will react to blood thinness and secrete a lot of lipid and cholesterol and release it into the blood in order to maintain the blood thickness. That is why the patient with nephrotic syndrome will have hyperlipidemia and hypercholesterolemia. Before we move forward, let me ask you some questions. What is the amount of proteinuria will be expected within 24 hours in patient with nephrotic syndrome? Is greater than or equal to 3.5 gram per day or per 24 hours. While the patient with nephrotic syndrome will present with generalized body edema, generalized body swelling, is due to what? Due to hypoalbuminemia. While the patient with nephrotic syndrome will be more vulnerable to infection, is due to what? Hypogammaglobulinemia. Why patient with nephrotic syndrome will be in hypercoagulable state? Because the patient loses a lot of thrombin 3. Why the patient with nephrotic syndrome will have hyperlipidemia and hypercholesterolemia? Because the liver will secrete a lot of lipids and the cholesterol and release it into the blood in order to maintain thickness of the blood. So in the next video, you will see causes of nephrotic syndrome. We have 6 main causes of nephrotic syndrome.